Hi, Dr. Meehika. How are you doing today?
I'm good, Snehal. How are you?
I'm also doing very well. Thank you so much for taking out time to join our podcast today. I am really grateful for that. Dr. Meehika, before we begin, for our viewers, I want them to have a brief introduction about you so that they can get to know you. So, could you please tell me something about yourself, about your qualifications, and where are you working right now?
Yes. So I have done my BDS and then I've done my MDS in public health dentistry. After that, I started working. I have my own practice, my own daycare center along with my parents. They both are doctors. And during COVID, I have also dived into the non-clinical stream. So yes, I've come the full circle.
Wow, that's very, very good to know. So you just mentioned that you're running a daycare with your parents as well. So
Yes.
coming from a family of doctors, what were the advantages or what were the difficulties or pressures that you faced while you were trying to build your professional identity?
So honestly, I never went through a pressure when it came to family because they understood that, what is the line, how much pressure does the line give. So no, I did not have the pressure. I did have the benefits. That was like exposure towards the patient, exposure towards the population. But exposure again alone does not help you to grow if you do not know how to position yourself in front of them. If you're a doctor and if you're not knowing how are the leadership skills, what are you going to possess in front of them, if you do not have the exact confidence that this is the like this is the patient, I'm going to deal with this patient like this. So I have a very diverse calm background. Along with that, I trained myself. I trained my leadership skills. I got into mentorship, and that's how I have truly what I personally consider myself successful when it comes to the work.
Hmm. Right. So was it your dream to become a doctor, or was it something that somebody inspired you or guided you? How did you end up taking the medical domain?
It was always guided. It was never pressured on me. It was like, it was never like that, mom, dad, both are doctors. So I always wanted to be one. And I never had a different thing in mind that I want to do something else. So it was
Mhm.
a purely guided passion thing, when I came into this. So I am a person who works even on Sunday. When it comes to work, you will see me in my hospital working, like, or not for like whole day long, but yes, you will see me working, say, like 9 to 1 or something. So that is how, I am passionate about my stuff.
Hmm. So what inspires you? Because for majority doctors, I am seeing that most of them are working for 12 hours, 10 hours, at least in a day, right? So what is that thing that inspires you to be in this profession and to keep yourself going on for such a long period of time, and also to not lose your patience while you are at work? And that's also one big thing. So what inspires you and keeps you going?
Course, the basic thing is passion, but passion alone does not work because what happens is you get overworked. You have so much, you are overstimulated. Like now these days, do this, then you will get this kind of success. Do this, then you will. So I actually trained myself. I had guided mentors along with me. Of course, my parents were one of them, but along with that, I did have my teachers, my guides, my HODs who helped me to like just stay on the path, be accountable for me, see my success, how am I doing this. And what I think is that is actually the distinctive factor. We don't have to work 10 hours, 12 hours, keep waiting for the patient that if they will come, not come, what new should I do, what old should I bring into practice. It is actually not that. It is the skills, it is the technology, it is the upgradation, it is your knowledge plus team management. You do have a team under you. You have to manage them as well along with the patients. So, it is a skill thing. You have to upskill yourself for that.
Definitely. And as you mentioned about team management, and the challenges that somebody faces when they are also doing medical cases as well as they're also handling a hospital or a daycare center. So somebody should have medical, managerial, and even people skills. So what were
Right.
your biggest learnings throughout this journey?
Still, I'll tell you what usually happens is people, measure success with finance. Finance is the main bracket. That I will never deny that it is not, but there is a pre-factor, how that I think that is decision quality. What kind of decisions are you making? Is your key selection good? Is your pricing conviction like stable? How are you managing the complications of the patients? How are you leading your team? How are you like how are you different from the crowd? Because now it is not that time where thousand population of thousand have one PTS or one dentist working. No, now you have 100. What is the distinctive factor between you and them? So basically, the learning curve, actually, just the one point answer is your decision quality, how you make, and it actually comes from guidance, it comes from skills, it comes from mentorship, it comes from accountability.
Wow, that's wonderful. And you have been trained across dentistry and also public health. Both of
Yeah.
them have been a part of your education. So, especially when I talk about this combination, so did this combination help you in treating patients today at your healthcare?
Yes, so I'll simplify it for you. So what happens is general dentistry usually treats the disease. What public health helps? For example, I am practicing in an XYZ area. There is a number of population near me. I know their financial bracket. I know what kind of diseases they are dealing through. So my case selection and my case selection criteria becomes very clear. I am not just laser focused on one thing, that this patient has this thing, let me just treat this and then I'll just go to the next one. No, you cannot do that. You have to build a patient doctor relationship. You have to build the confidence, and plus you want to retain the patient. Now that is a something, like that is something which you cannot just manage by doing general practice dentistry or practicing the general, whatever the, or thinking maybe I will do this kind of course, and then after 5 years I will get this kind of success. It is not like that. Now you have very good exposure towards a lot of things. For example, like I know you guys provide, I think it is an internship or fellowship, or maybe a some span in a hospital where there is exposure towards the patient.
Right, we provide 2 months of observership at hospitals, at our partner hospitals, right?
Yeah. So what helps, what has happened, that we do get our experience, practical experience in universities, but that is a protected layer. Now what happens when you're not protected? What happens when suddenly you get into a legal thing? How will you manage that? Who will help you? So you actually need accountable partners, guiders, mentors who will help you to pass through that. I'm not just talking about the legal thing. I'm actually talking about the cases. I'm talking about the patients. I'm talking about everything which comes into the picture. And it is not just this one or two factors. There are so many factors. Very few people are actually blessed. Like I actually have that, from my childhood, I've seen that thing. So that is the reason I might get out, very quickly. But
Hmm.
that is not the case with everyone. There is a hesitation to work, then suddenly we get scared, suddenly we do not know what is the way out. So I think that you have to be protected, stable, calm. You have to know what you're doing and you have to know your way out. So that is how an established practice is managed.
Right. It's been quite some time. We were discussing about what kind of a fellowship course should be launched for BDS doctors, and then eventually you suggested me the idea of having a fellowship in advanced clinical dentistry. So, how do you think, or can you just provide us a brief about how it would help young BDS doctors, especially those who are either working at a clinic or maybe planning to opening one clinic in some time?
Advanced dentistry is an intensive thing, Snehal. It is not an easy job. So what happens in advanced treatment? Let me just brief it out to you in some simple words. You have technical upgradation. You have the most upgraded, instruments or upgraded machines inside your dentistry. First of all, it reduces your time. It reduces the patient time. It increases the comfort of the patient. And then what happens is you retain the patient. If a
Hmm.
patient is coming to you and you are actually practicing advanced dentistry and I'm practicing the general dentistry, I'll say now, like, come back again 3 days, come back again 5 days. But the patient will go, no, I think Snail is providing me everything in 15 minutes. Why should I not go to her? Why should I not go and do that thing? Maybe pay some few bucks extra, have my time, have my comfort, and just, finish the work. Why would, it is a straight way, you just get, this is the plain distinction between a general dentist practicing and someone who is having knowledge. What is the chair side time? How are you going to manage the patient? If a patient is coming, what are the core details or the core work which a dentist should do? What is the core work which an MDS should do? What are some restorative procedures or some procedures which can be done by the helpers, or what are the chair side instructions which can be given by the helpers? That is not taught inside an university. That is actually a skill which needs to be done practically, not in the university cases, but face to face, when you actually see the patient, when you actually have the flow, when you actually know the finance bracket of the patient. Is your patient actually okay with the procedure and okay with the price range? With this you can actually open an elite dentistry practicing with along with celebs as well. So that is something which actually involves a lot of intensive practice. It cannot be done alone, or you just hope that I'll learn this and then maybe I'll go. So it has to be like a stepwise process. In easy words, like, it has to be stepwise, it has to be monitored, and it has to be 100% success rate. You cannot do it alone. You cannot just throw something into the air, just throw spaghetti on the wall, and then it is like getting it is not like that. It is
Hmm.
100% work which actually requires a mentorship.
Right. That's very correct, Dr. Mehika. And also, many young doctors today, they struggle to balance clinical excellence along with entrepreneurship. So, what mindset shifts are essential when you are planning to balance both of them when you are moving from a general practitioner to a healthcare leader? So, what do you think are the shifts that are needed in those situations?
What happens is, like, entrepreneurship is usually a bit misunderstood. It is linked to aggressive selling of products or aggressive selling of our practices. But we as a doctor, when we come into the picture, we actually have to be we are a different crowd. you know we provide values more than the aggressive sales or finance. What happens is we have to provide value. How are you establishing the trust with your patient? What are you giving which is different from another dentist? And how are you retaining the patient again, just to continue your revenue cycle? So that is how you have to merge things up. And you cannot just like just have a general idea from your past experience from the college and just start with it. You have to be excellent in your work, you have to be excellent in your diagnosis, and you have to be excellent in your patient relationships as well. So yes, that is how you build your clinical career, which is smooth and which is certain, which is stable.
Right. So I believe this is more about blending the skills that you have, your
Yes,
clinical
yes,
skills as well as your entrepreneur skills. So I
exactly.
mixture of both of them. Am I
Yes,
correct?
yes.
Yeah.
Yes, it's absolutely, because what is the main thing over here is everyone is actually thinking that once I open this, okay, beginner's luck, sometimes it does work. I am not saying that beginner's luck is not there, it does work. But what happens is then you get into a certain what you call a routine. wherein sometimes you have patience, sometimes you don't have patience, sometimes you have patience, sometimes you don't have patience. That is, a curve which is happening with everyone. But what I suggest is, instead of going in this kind of cycles, please give yourself an opportunity to upskill yourself. What is there that I can do which will help me give my required outcome? And today we actually have the ways to have that. Since you guys are also providing the observership, I think that is the most important thing. Anyone should go for it, blindly just go for it. Get into the hospital system, make contacts, see the patients, what is actually happening over there. If anything bad is happening, just be present, expose yourself to an environment which is actually going to help you in future. So that is how, you should gel up the clinical excellence with your entrepreneurship.
Right, that's very correct. And now that you have a good amount of experience, you must also be hiring, or maybe hiring young doctors as an interns at your center as well. So, what do you think is missing out from the freshly graduate doctors today?
I actually, let me just be very clear. I don't think it is their fault. But what happens is, people are actually vulnerable at this stage. So they hesitate during the work. Maybe I should do this. Maybe I should not do this. They cannot plan the case. So basically, there is a case planning. So case planning is very vague when it comes to that. They are very vague about this. So they are like, he's just having this kind of skill. He just requires scaling treatment. Let me just do this. They are not going deep inside the treatment planning cycle, and retention of the patients is a bit of a loose end on that side, and that's how their confidence is low. So I guess these are the 3 points, which it is, again, I'm telling you, it's not their fault. It happens because once you get out of the university, you are on your own and you don't know how to face things. So that is how, mentorship comes into the picture. That is how, experienced people can come into the picture. That is how having a big setup or a big, hospital like exposure comes into the picture, which will actually help you to gain confidence, which would actually help you to protect yourself from something which is not, you're not used to it. Because it is the truth. Sometimes things happen out of surprise, and how are you going to approach that thing? So that is how these are the things which actually lag. But this can be definitely, that they can be practiced, they can be skilled. So I don't think that anyone is imperfect, or things can be learned.
That's very nice of you to share all of this with all the young doctors, especially those who have recently graduated or maybe are having 2 to 4 years of experience. When they listen to these things, they understand that what are the mistakes that they should be avoiding, right? So this
Exactly.
makes a very good impact on them. So if we talk about upskilling ourselves, as you just mentioned, so in today's evolving healthcare system, what do you think? How impactful it is for a doctor to upskill, do a fellowship, or do a certification course? Do you think that this will actually help the doctor out?
Let me give you a spin around to this. What is the distincting factor between you and the other dentist? What different are you giving to the patient? You're not giving anything different. Then why would a patient, come to you? He's getting same over there, same thing over you. That is where upskilling comes into the picture. General dentists might not know some things which you have inside your clinic, something which you are practicing. Let me give some examples to you. You are practicing highly developed technical skills, like you have the most advanced setup inside your clinic, which first reduces your time, it increases the patient comfort, and then it also reduces the patient time, which actually increases the comfort and retains the patient towards you. Again, that is how, and it is not built by, like, just let me just go and do this kind of course and now I am ready for it. No, you actually need, after you do the course, do you actually have someone who is actually getting accountable to you, that okay, Snail, you're doing this, have you taken this into consideration? And okay, if you have taken this into the consideration, after a month, are actually getting the revenue out of it? No, you do not have that. So upskilling along with mentorship, along with the guidance even after the course, is very important. So that is how upskilling is different. So foundation is on the both side. This is, even that person is a doctor, you are a doctor, you both have the degrees, but you do not have the distinction factor. You do not have that kind of factor which is actually giving you the results. So it's like, waste of your time, waste of your energy, and plus you just get overstimulated and you don't know what to do, and that is a very bad place to be in. That's where
Yeah.
upskilling comes into the picture.
I've often heard of freshly graduated medical professionals that they are really feeling very overwhelmed from the exposure that they are having right now. They are working for a very long period of time and they are clueless about what to do. In fact, many of them are even clueless whether they should actually go for a PG or not. After MBBS, they feel that okay, this is it. Now I would like to be here, or maybe I would like to just stick to a clinical role, or maybe shift to a non-clinical role if that pays better. So these are certain things that I've come across nowadays. So what you
Yeah,
said
it
is
is a dangerous zone. I mean, it is a very good point which you picked up. It is a dangerous zone to be in. I mean, you cannot, why are you giving yourself so much of pain? Just, if you don't know, like, what are you going to design in the future, please do not be in that place. Make a picture for yourself or design something for you, that okay, I'm going to follow this, it is, be it a non-clinical side, be it a clinical side, whatever side you want to choose, but what am I designing for myself? So that, please be in that kind of zone, you know that you're going from this place to that place.
right. Dr. Mehika, you completed your dentistry and then you did a master's in public health. You opened a clinic, then you opened a daycare, and now you're handling a daycare in Mumbai. I can understand how hectic it would have been. So, today, via this podcast, if you had to advise young women, all clinicians, but mostly focused on women clinicians, on building sustainable, ethical, and successful medical practices, what will you tell them?
I would tell them start at very, like, start very early. I started planning, like, I'll give my example. I started planning on second year. So I knew within 10 years I want to go there. I want to establish a practice which is painless for the patient, which is quick for the patient, and which has the most advanced system, which would be comfortable for me as well as for the patient. Less time for me, less investment from my side. Time is investment is coming from Mumbai. Mumbai people, we have very hectic routines, so we do not want to invest so much of time, like men go for 3 to 5 days. We would like give more money, or in fact any people from any part would give like more money, just have this kind of money and get done, be done with my treatment in 15 minutes. That is what is the lookout. So that is what I got into myself, say, 10 years ago. And I knew exactly, I planned myself, and then plus I had the decision. So decision and planning, these are the two things. Please work on them. If you want to go into the clinical role, if you want to go into the non-clinical role, please do not skip these things. That is what is going to help you in the future. You sort your future right at that moment, and then you just, you'll just move guidely towards, whatever is your goal. So I always wanted to be a family person after marriage, and plus I wanted to be into my work routine as well. So I'm handling both, and I consider myself successful in that.
Wow, I'm really happy to know that. At the same
Nice.
time, we were talking about fellowships and we were talking about upskilling ourselves. So you mentioned one thing, that having an hospital observership also helps the doctors a lot, because they
Yes,
get to meet patients, they get to treat them in real time, they get to diagnose, and they also get some good mentors while they are doing this, who can guide them on
exactly.
what is right, what is wrong, what can be done better to improve efficiency. Along with the hospital observership, any other advantages you feel that Medical's fellowship give them?
What happens is, you when you have someone who is actually experienced, you reduce your time. And today time is a very important factor, when it comes to anything. Time is a very important factor. Like if I want to complete a case within 15 minutes, and the same case is getting completed within 3 days, whom do you think the patient would prefer? I think it would be me. I mean,
Completely.
wherever you go, the this is a, like, this is an outlook which has been evolved. So that is how you guys come into picture. I know you guys have very highly professional and highly, like, very great doctors with you, who are actually helping the not patients but the students to evolve themselves into better professionals. So what I want today's generation to know is that just reduce your time. Please have someone who is actually having the knowledge about the things which you are trying to do, and that is how you just get successful. You don't have to slog for 5 years, 10 years. This much amount of time I have to give, this much amount of time will be, happening, and said no, it is not. That time has passed now. Everything is getting very fast. Once you have that kind of exposure, once you have that kind of accountability, mentorship in your life, you do not get it anywhere else. And plus, stop giving yourself that kind of pain in your life. Just give yourself that opportunity of being helped, of being trained, of being, uh, being at ease, basically.
That is so nicely said, being at ease. I think this is
Yeah.
very important, because along with your career, you also have a life to focus upon. So I think this
Yeah.
makes a lot of sense when you said that you need to work on the opportunities and also be at ease. Yeah,
Yes, exactly.
sure, Dr. Meghna, this would be a very eye-opening conversation for young medical professionals, especially for young dentists who are either planning to open up a clinic, or they want to stay in a clinical and a non-clinical career. They want to combine it together, or they want to be an entrepreneur. So anything that they are looking for, I'm pretty sure this would be guiding them a lot in the initial stages. I
Exactly.
really appreciate that you took out so much of time from your busy schedule to connect
Yeah.
with us today. And before we end this conversation, there's just one last question that I would like to ask. You're associated with MediCOLL, and what are your views about us, and what is the message that you would like to share with our students?
So nowadays, a student usually they do not require more information. Everyone is I think everyone is very intelligent. Now they usually require a structured pathway. For example, I want to reach the school. I want to reach the school in a shorter amount of time. So give, like, invest in yourself. You know, uh, know about the things. Get your educate yourself from people who have already done which you want to do, and that is how you will reach your goal very soon. You don't have to slog yourself. And I actually wanted to say this from my heart, because I belong to this this BDS MDS group, and I feel so sorry and I feel so sad about people, if they are losing hope, and if they are thinking it is the BDS is gone, the BDS is ending. No, please, it is not like that. You actually need to upgrade yourself. Please upgrade everything which you are actually training your mind to do. It is the upgradation of the technology. It is knowing the recent trends. It is having someone who is accountable for you and accountable for your success, who is already successful. Please be with that kind of groups. And next thing is, give yourself opportunity to be trained from the person who has actually done the thing. And plus, stay in touch with that kind of mentorship. Just doing that thing and over, no. Once it is over, the real game starts over there actually. So if you're doing this, let your mentor know that, okay, I'm doing this, is it going to help, this is the situation. But your guide always knows that, okay, so this you can do, eliminate this point. That is how
Right.
you reach your goal faster, easier, and as I said, it would be very comfortable for you as well as your patients. And please upgrade your technologies. Don't think that using traditional ways are actually going to get me newer results. Traditional ways actually get traditional results. Upskill yourself, upgrade yourself, know what is going on. And very few people know the power of getting mentored. I want to stress on this point. It is like, oh my god, I am a doctor, I'm a class 1 officer, why would I require someone else to guide me? I can do everything myself. No, do not underestimate the power of mentorship. I used it when at a very young age, and that is the reason I think I am living a life which is financially free. I do have success in my work. I do enjoy my family life. I think I consider myself a very stable person at all angles. So please, if you find yourself that this is the block in my life, I don't know how to upgrade my career, get educated, have a mentor, have a clarity. There has to be a clarity in the direction in which you're going. That is only the thing. And having skills, no one can stop you.
That is very true. I was listening to you. I was mesmerized by whatever you were sharing. Because even if I look at my career, I've always felt that nothing replaces a good mentor. And you will have to actually search for them in your life. You will have to search for people whom you can trust and whom you can follow. And they can also, help you in the best way possible. And I think this has been highlighted in so many times in so many books. If I talk about the world's bestsellers, and so many other books have highlighted the importance of having mentorship, and also highlighted the importance of doing things quicker and smarter. So we are all
Exactly.
intelligent. We all have smartphones available with us. We all have a lot of information. But then somebody that helps us to understand which information is correct at what time. I think that is very, very important. And of course,
Exactly.
when we get that mentorship, I think we also, learn from others' mistakes instead of repeating them again. So I think
Yeah,
that.
so nobody here is like failing or getting behind, because we pressurize ourselves on the time that now it is the time, now I should be making this much amount of money, x amount of money, this much amount of money. Of course that is an important thing, but then again, what I said, that there are some pre-factors. Just get clear on that. That might be a blind spot, that might be a block inside you which you cannot see. But the person whom like, you trust someone, you invest in them, and they actually do have the knowledge. If your blocks get just cleared, I mean, imagine you, if you require 10 years to clear your block, someone is giving that thing in 10 seconds to you. Why would you like keep yourself away from that kind of opportunity? It is a senseless thing. So that is how the fellowship program works. We provide the education, we provide mentors, we provide accountability, we provide the observership. And how are you going to now going into, if you want to go into clinical, please go into clinical. If you want to go into non-clinical, please go into non-clinical, wherever you find yourself comfortable. But please do it at a pace which is actually good for you, advantageous for you. You don't have to be in the dilemma that am I doing this correctly, am I not doing this correctly. Just get out of that zone. Never be in that kind of zone. Get educated.
Wow, Dr. Meehika. It has truly been a very inspiring session. It has been inspiring for me also. Because when we meet people, we talk about so many advancements and so many things we discuss. We never know who is looking for what answer, right? And I'm pretty sure that this would be very helpful to all the doctors who are watching this right now. And thank you so much again for taking out time. I can see that you have also put in a lot of effort, and we have been coordinating for a long time to connect and finally have this talk. I'm very
You
happy.
are a total ray of sunshine, Snehal. It would have been a very difficult interview if you would have not been there. So thank you for the opportunity.
Yeah, it really means a lot to me, Dr. Mehika. Thanks
Yes.
a lot. Your kind words definitely have made my day. Thank you so much again for being there. And I'll just end this podcast right now, and
Yes.
I'll be sharing it across with all the audience. And I'm pretty sure this would be helpful for them too.
Yes. Thank you so much.
Thank you, Dr. Mehika. Have a great day ahead.
Same to you.